iodine. The contrast that we use to highlight some of the anatomical structures for an X-ray procedure is iodine. And what do we know about iodine? Can it be harmful?
Mm-hmm.
Can it cause biological and physiological effects?
Yep.
Okay, so this is why we are going to discuss drug administration. All right, and that's what we introduced. That's what we talked about iodine reactions and anaphylactic shock in the last couple of meetings, okay, because iodine has that type of effect. All right. So what we're going to be talking about first here is the ASRT. The ASRT is the American Society of Radiologic Technologists. They are the ones who sets the educational guidelines for technologists and determines what is and is not within our scope of practice. It says here that venipuncture does fall in the profession scope of practice and practice standards, and that it shall be included in didactic and clinical curriculum with demonstrated competencies. What that's saying is we have a certification or licensure that's particular to our profession. And it's basically semantics of the word. Because what we're doing here is actual phlebotomy or venipuncture. But the key here is we perform venipuncture for the administration of contrast agents. Okay? So I cannot walk into an institution as a rad tech and they ask me if I have my venipuncture license. Phlebotomy doesn't count. Okay? The techniques are all the same, but the nuance is venipuncture for the administration of contrast agents. That's where they get you. Okay? So you cannot walk in with a certificate that says, hey, I got my phlebotomy.
Start drawing blood.
Yeah. Okay. And that's the thing. We can start a venipuncture, but we can't draw blood from that. You can only push in, what is it that we're pushing in? Iodine. We're pushing in iodine. So those are the rules, those are the guidelines that we follow as technologists. Our students next semester will be performing venipuncture on one another. There is going to be a didactic portion where we're going to spend about 4 to 5 weeks lecturing on just venipuncture, anaphylactic shock, CPR, all those goodies. And then the remaining of the semester, they have to show proficiency by doing venipuncture on one another. Okay? So let's get a couple of terms out of the way. Drug and medication are generally thought of being the same thing, but they're not. They're very different by definition. What I'm going to be doing here is I'm just going to give you the basic general definition. Of course, again, just like any other terms, there are nuances that separates one from the other. When we're talking about drugs, drugs can provide positive results or it can have negative effects. Okay? But a drug is any chemical that has the capability of causing these type of biological and physiological responses or changes. Okay? Again, I'm going to keep this very basic. So that's what a drug is. And then medication is once it's been instilled in the body. Okay? So we're talking about before, in a vial, okay, in particular in a vial, or once it's administered, it now becomes a medication.
So passive and active.
Exactly. Before and after. Okay. So basic knowledge for a radiographer. Before the administration of contrast media, we already know that it is good in helping us making a diagnosis, a proper diagnosis on radiographs. Okay? But we also know it can be very dangerous and also deadly. So we got to have these basic guidelines. First one here is a safe dosage. What is the correct dose to administer for this particular study that we're doing? Any procedure that requires some kind of contrast, there is a minimum required dose, and you've got to have an understanding to that. Okay? Because if you give too much, okay, it can be safe, normal doses, but if you go beyond that, then it can become lethal. Safe route. We're going to be talking about different ways in which these contrast agents could be administered. By vein, by artery, through the joint, through the mouth, through the rectum, okay, through the spine, through the abdomen, through the lungs. Okay, the safest route possible for that particular procedure. We're also going to be talking about limitations, side effects, and potential adverse reactions. We got to understand the limitations of the drugs and the type of responses that it can cause. It can be transient. It can be
adverse.
Okay, it can be an adverse reaction, mild, moderate to severe. Okay, the purpose of the use of this particular contrast and also contraindications, why we shouldn't use a particular contrast. For example, what is a contraindication for iodinated contrast? If you have a history of what?
Kidney disease.
Okay. Kidney disease. What's another one? History of allergies to foods or medications, right? History of asthma and hay fever. If you are young, if you are old, if you're diabetic, okay, these are all different types of contraindications for not using iodinated contrast. Now, contrast agents are categorized as drugs because, as we had said, it can cause biological responses. 30% of the procedures that we perform, that's a huge number, 30% of the procedures that we perform requires some form of contrast agents. When you're looking at an x-ray, it's very easy to see bone, right? We know what bone looks like. But if we were taking an x-ray of our abdomen, we can see the spine. But what about the structures within that abdomen? Very difficult to delineate the stomach from the kidneys, from the liver, from the spleen, large bowel, small bowel. All those become very difficult to see unless we enhance it by administering some form of contrast agents. Two terms, radiopaque. Radiopaque means that the anatomy is filled or outlined by some form of positive contrast agent. Again, when you're looking at, this is an abdomen, it's very easy to see the spine. But now we want to introduce a contrast agent that is very similar to bony composition. Bony composition. And when we instill the type of contrast, now you can see, for example, the outline of the stomach. It has the same composition of that of bone. It is white. Okay, so we can see the stomach, we can see the duodenum, okay, we can see the jejunum, and if it continues to fill the bowel, we'll eventually see the ileum and the rest of the large bowel. Okay, so it looks white, it's opaque, it's solid, bless you. Radiolucent is anatomy that is filled or outlined by a negative contrast agent. So in our field, we also use air as a type of contrast. Okay? When you look at air, it is negative, therefore it has the opposite effect. It's black. Okay? So that's the difference between opaque and radiolucent. What we're going to be talking about here is contrast agents that would opacify the structure. That would opacify, see, radiopaque, to opacify different anatomical structures. Okay? So the first one that we're going to be talking about here is barium. Barium is considered a positive contrast agent. It is radiopaque. It's solid. Here is an X-ray of the abdomen. Again, bone is not obvious, right? Because you can see the ribs. You can see the lumbar spine. Here is the pelvis. Here are the hip joints. But we can't see liver, stomach, bowels, small, large. We can't see the kidneys or the ureters. But they're in there.
Is that you can kind of make them out, right?
You can make them out by some of the patterns. But you should also know this based on your knowledge of anatomy. That's why when you guys get into the program, your anatomy has to be solid. Because what we say is you got to use your X-ray eyes. You got to know where the structure is out even before they become opacified. Okay? Now this is what happens when we introduce a radiopaque substance. Now we can see what we're looking at here is the outline of the large intestines. You have your ascending, transverse, descending, sigmoid curve, and then you have your rectum right here. Okay? Barium is a metallic suspension. It's metal. Okay? Metal is solid, right? But we're going to use this barium. It's grinded metal. Don't think of it like metal shavings, okay? It's just a metal in powder form. And then we mix that up with water and we introduce the contrast by way of mouth or through the rectum. This barium is generally used for GI studies. GI studies. Gastrointestinal. Okay? Because it is metal, your body cannot absorb it. Do you hear what I said? Because it is metal, your body cannot absorb it. So we are going to get rid of this contrast agent by evacuation. You guys know what I mean by evacuation? Go into the bathroom. Go and poop. You got to poop it out. If it stays in your system for a long period of time, what did I say? Is it metal? If you don't get rid of it, it's going to get hard. It's going to cause a blockage. So what we tell our patients is after they have a barium study, we tell them to take plenty of fluids so the material becomes diluted and they can easily evacuate it. Because if it causes a blockage, you're in deep trouble. Yes?
So it can be removed like by peeing too?
Nope. This is only your GI system. Okay, your gastrointestinal. Okay, so you're going to evacuate it through your bowels.
So how come you have the bone slide over there? So how you get with barium and that type of for the bone exam? What are you talking about?
No, I don't know what you're talking about.
Okay, so are you using barium for the bone study also?
No, see.
Bone is solid.
Yeah, see, this
oh,
is
you
just
have an example of that bone.
yeah, this is just a regular abdomen.
Okay.
But I want to look at the rest of the anatomy here. So to look at the GI anatomy, now they're going to either ingest it or rectally take it. I don't know what the words to say.
Yeah.
Rectally insert it.
Yeah. Also for the bone, that's the reason.
No, that's just a KUV. It's just what we call a kidney ureter bladder X-ray.
Okay.
It's a scout image. It's a preliminary image of the abdomen. That's it. Okay.
So before you guys do a barium study, you always take a before.
We take a scout film. Yeah, we take a preliminary film just
like our baseline then?
Yeah, exactly. It's baseline because what happens is, and again, I'm kind of going off subject here, guys. We do a KUB to assess the abdomen before the administration of contrast because if there's something there,
blockage,
and we didn't take an X-ray. Now that you have this radiopaque substance in there, it's going to be hiding behind the contrast. So what may be there is now hidden.
So if there was a blockage, you'd already see it on the...
No, you would not see it.
Okay.
You would not see a blockage until the
You got in
contrast is
there.
administered. Okay. What I'm saying is, for example, like kidney stones. If there were kidney stones in there, now we can't see because we blocked it with the contrast that they ingested. So we always take preliminary films just for an initial assessment. Okay, in case there's something there, and now we can't see it because of the contrast. Okay, now, it has a high atomic number of 56. It's very solid, very opaque. The whole purpose of this atomic number is that the higher the atomic number, the more solid the solution is. The more solid the solution is, it gives us better opacification of the structures. Okay? The higher the atomic number, it gives us better opacification. Because again, we're trying to make it look close to bone so we can better see the anatomical structures. Okay, are you guys with me so far? Okay, so barium then is a metallic suspension. It has a high atomic number of 56. It cannot be absorbed by the body, and you have to evacuate it by going to the bathroom, going number 2. Okay? Okay, the other type of contrast that we use is iodinated contrast. When I say iodinated, what's the main component in this contrast?
Iodine.
Iodine. Okay? Iodine comes in 2 different forms, and we're going to be talking about this later on. But the main component here is iodine. When introduced intravascularly, okay, this goes back to answering your question over here, okay? When it's introduced intravascularly, now we can see the vessels of the body. You don't want to put barium into your vessels because you're going to kill them. Remember, barium is a metal. So we're going to use something that's a little bit more forgiving to the body. Iodine contrast. So when injected, look at this. Now we're looking at kidneys, ureter, and then the bladder. Well, wait a second, Dr. F. You said you just injected it vascularly to the vein. How come we're seeing kidneys, ureter, and bladder?
Filters the blood.
Okay? It goes into your circulatory system and eventually ends up in your kidneys, right? So that's what's happening here. So when the contrast is mixed with blood, it goes into the kidneys, and now the contrast is mixing with the urine that's being produced in the kidneys. As urine is trickling from the kidneys down to the bladder, now you can see the ureters. And eventually, the bladder fills up. Okay? So this type of contrast is done for vascular studies. Vascular studies, whether it be the vein or the artery. Okay? Again, I'm keeping it very general. Okay? But it's done for vascular studies. The good thing about this, too, is that they can also drink this contrast, or it can be reduced at the other end, rectally, for visualization of the GI tract. Okay? So, isn't this a great picture? We're seeing everything here. We got stomach, we've got small intestines, okay? And then we've got the large intestines starting to fill up.
For these studies, do you have to like clean out your system before?
Yes, you do.
Fasting.
So you got to be, yeah, you got an NPO, and then we also give you a laxative to clean out your bowels.
Oh.
So the first day before the procedure, you're constantly in the bathroom. You're just going. Yeah, you're just going. But you have to be cleaned out, because if we introduce this contrast and there's fecal material in there, it's hard to determine whether or not that's a tumor. Okay, so we got to have them empty. All right. All right, so as we said earlier, drugs treat illnesses. They are administered in small doses at selected intervals. The contrast that we use, okay, do you remember the term isotonic? Did we talk about that last time? Mm-hmm. Isotonic means having the same consistency, thickness, kind of the same composition of that of blood. Most medications that we use have that same consistency of that of blood. Very similar. Very similar. Okay? However, the contrast that we use, is it like blood?
It's thicker.
It's thicker. It's viscous. Okay? Remember what we talked about. Your body is always in a state of equilibrium, equal pressures, outside, inside. It can be equilibrated with your body, or it can be equal pressures at the cellular level. It can be equal pressures within your venous and arterial level. Okay? But we're always in a state of equilibrium. And as we discussed the last couple of times, when contrast, which is thicker, is introduced to your vascular system, there's going to be a sudden shift of fluids going into the vessels to dilute it. Okay? And it's the sudden shift of fluids from the extracellular portion into the intracellular portion that causes this type of response, which can lead to what? Anaphylactic shock. Okay? So those are the things we got to be concerned about when we are injecting these contrast material intravascularly, is that shift of fluids and the possibility of causing shock. I'm not talking about iodine reaction, because iodine reaction is what?
Transient.
Okay, it's an allergic reaction to the antigen. It's a foreign material. So it's an iodine reaction because it's thinking it's basically an allergic reaction because it's foreign material. And it's an iodine reaction that can lead to anaphylactic shock. You guys remember all this? Okay. So the contrast that are given, we can give it in two different speeds. Two basic speeds. Either in a bolus, where we're talking about a large volume in a small period of time, okay, such as taking 50 cc's and injecting it in 2 to 3 seconds, okay, or we can infuse it. Okay, infusion is a slower rate. We're talking about the same volume, but at a slower rate. Know the difference between bolus and infusion. Bolus is large amount, short period of time. Okay? Infusion is the same amount given at a longer duration. Longer duration. Okay. So as we said with iodine, it has the main component here is iodine, sorry. Contrast agent, the main component here is iodine. It has an atomic number of 53. What was barium? 56. It's only off by 3 numbers, but it's a significant number, a significant difference. Okay? That's why we don't like to use it for the GI system, because it has a lower atomic number. 56 with barium, you can see the outline of the GI system very well. With 53, you don't see it very well. That's why it's only used for the vascular system, because it's a smaller area. We're not looking at big areas. 53, when introduced to a small vessel, becomes very concentrated, so you can see the vessels very well. Is that making sense, guys? Okay? So, with iodine, it increases the opacity of an organ or vessel when introduced. Again, mostly done for vascular studies and occasionally for GI studies. Iodinated contrast is water soluble, which means that your body is going to absorb it. Remember, barium is metallic. It can't get absorbed. Okay? So we have to evacuate it. We have to get rid of it.
Isn't iodine a metal too, though?
Iodine is a type of metal, yes. Okay? But not like, yeah. Barium is not absorbable. Iodine, although metallic, it is absorbable through your body. Okay? So most types are water-based or water-soluble, meaning that your body is going to absorb it. Let's go to the next slide. Okay? So when used in vessels or organs, in vessels it mixes with the blood. Remember the previous 2 slides that we saw? In your blood, and then eventually goes to your kidneys? Where's it going to go after that?
Pee it out.
You're going to urinate it out. You're going to pee it out. Okay? So that's how you're going to eliminate the contrast. It just pees right out. And when you pee it out, it just looks like pee. There's no smell, there's no odor, there's no color to it. Okay? If it was introduced in organs like your GI system, it is reabsorbed into the bloodstream by surrounding body tissues. Remember that equilibrium? Okay, so it's going to be absorbed by the vessels, the surrounding vessels. It's going to go into the blood vessels, go back to your kidney, through your ureters, and then you're going to pee it out.
So it goes out the same way every time?
It goes out the same way. It's absorbable. It goes back into your vascular system. Okay? The misconception about iodinated contrast is that it's called a dye. Well, look at it. It's clear. Okay, it's clear. You hold it up, it just looks like water in a vial. Okay? But we don't call it a dye, we call it contrast. And besides, we don't say dye. Okay? So there's a bad annotation to that. We don't say dye. Okay? Throughout my lecture, have you heard me say dye yet? Well, I said it a few times just a few seconds ago. But it's not a dye, it's a contrast media. Okay? Most are colorless and transparent to the visible eye. Its ability to enhance visualization of the structures is due to its ability to absorb X-rays. Remember, iodine is 53 at the atomic number. All right, let's skip this for a moment. So cross this out. Okay, I don't want to confuse you. Let's cross out the third bullet point. We're also going to cross out this slide. Okay, that's another class. What I do want you to get out of this is that the contrast, iodinated contrast, comes in two different forms. That is what the previous slides were saying, is that it comes in two forms or two molecular structures. I'm not going to get into the chemistry of it right now. But the two categories are ionic and non-ionic, and that's based on its molecular structure. Okay? So iodinated contrast is ionic or non-ionic. Also, don't get those terms confused. Iodinated means what?
Iodine.
Iodine. Whether it's ionic or non-ionic refers to its molecular structure. So if I say ionic contrast, does it have iodine?
Yes.
Yes.
If I say non-ionic contrast, does it have iodine?
Yes.
Yes, they have iodine. That is the main component. All right? So here's the difference between ionic and non-ionic. Ionic simply means that there is more iodine. And if it's more iodine, is it going to be isotonic? Remember that term isotonic? Is it going to closely resemble that of blood?
No, it's going to be thicker.
Okay, it's going to be thicker. It's going to be a lot more thicker because it has more iodine. Now, because it has more iodine and because it's thicker, what happens to the physiological part of you? Is there going to be more shifting of fluids into the vessels?
Yes.
Yes, there's going to be more shifting of fluids into the vessels. What are your chances of now of having a iodine reaction, or let's take it to the extreme, an anaphylactic reaction?
Greater.
It's going to be higher. It's going to be higher.
Do you infuse that one?
Either way, you can either bolus it or infuse it. Okay, but because there is a higher concentration of iodine, how do you think the images are going to look?
Right.
It's going to look so bitchin'. It's going to look good. Okay? It's going to look really good, really solid. But the downfall to that is greater chance of what?
Anaphylactic.
An anaphylactic reaction. Okay, let's go to non-ionic. Is there going to be more or less iodine in there?
Less.
There's going to be less iodine. But what does that mean for the patient?
Less chance of.
Okay,
More
it's going to be less toxic. Okay, the chances of having an anaphylactic shock decreases. Okay, so less iodine. Okay, less of a toxic effect. But what about our images?
Not as
Not
good.
as crisp.
They look cruddy. Okay, they look cruddy. So this is where the economics and also patient considerations come into play. Okay? Do we want really good images with the possibility of our patient going to an anaphylactic reaction? Or do we want crappy images, but patient safety is at hand? It's a priority. It depends on what you're looking for. It depends on the economics. Okay? Most places now what they're doing is that they are using the ionic contrast and pre-medicating our patients. Okay? With Benadryl, which is an antihistamine, or some kind of steroid, which is anti-inflammatory. So they pre-medicate them the night before and the day of to minimize the chances of having an anaphylactic reaction. and you get the images done at the first go. Okay? When you're using non-ionic because the images don't look good, guess what the doctors are doing? Not repeating it, they're pumping more contrast into the patient. So they're receiving the same amount of iodine anyway. Does that make sense?
No.
You're charging the patient more because you're using more non-ionic contrast. Okay? So yeah, so it does fall into the economics and things and what you're looking for in your images. Okay. So, so before the administration of contrast agent, whether it be ionic or non-ionic, remember they both contain iodine, right? We still have to do a thorough history. You, as technologists, will be doing a thorough history. You're going to be asking your patients some questions. Miss Jones, have you had